Good health today, the opioid epidemic and the danger that it poses for children.
Yeah, we've really heard a lot about addicted parents placing kids in harm's way, but drugs are also ending up directly in the hands of children. So our Dr. Frank McGeorge is here with a closer look at this problem, Doc.
Well, Devin and Kimberly, over 650,000 opioid prescriptions are dispensed each day in the United States. These drugs are ending up in homes where children live and play, potentially putting them in harm's way.
It's a side effect of the growing use and abuse of opioid drugs.
Central Iowa Poison Center.
An increasing number of calls to poison control hotlines.
In this study, we found that poison control centers in the United States receive a call every 45 minutes for a child that's been exposed to opioid medications.
The study by Nationwide Children's Hospital found a sharp increase in poison control calls related to opioids initially, but a drop since 2009, with one notable exception.
We saw a pretty significant increase among young children getting into medications that are used to treat opiate dependence. Buprenorphine in particular had a significant increase in exposures to young children.
Drugs like buprenorphine or Suboxone are especially dangerous. They're primarily used to help people addicted to heroin or other opioids, but in the hands of children, they can be deadly.
When children get exposed to buprenorphine, if mom or dad sees it happening and they take the pill out of the child's mouth, that child can still go into a coma and stop breathing many hours later.
Experts are calling for stronger efforts to protect children, including changes in how these pills are packaged. Instead of loose pills in bottles, they suggest increased use of blister packs or single-dose packing.
Keep these things up, away, and out of sight, preferably in a locked location so they can't get access to them.
Now, while children younger than 6 years accounted for the most exposures, teenagers, of course, are also at risk. In fact, the rate of suspected suicides due to prescription opioid exposure among teenagers rose nearly 53% over the 16-year study period.
You get two very different things going on there with little kids. Accidental exposure, but with teenagers maybe looking for trouble.
Yeah. Exactly, and that is why it's so important to keep everything locked up, secured, or dispensed of when you're done with them.
Right, so important. Okay, Doc, we appreciate it.